from Dino for the product presentation.
Very good afternoon to all of you. My name is Amarnath and I come from this organization, Dino Private Limited. Firstly, thanks very much to this organizing committee who gave us the opportunity on this platform to showcase our product and so that we could reach out to a larger audience. Here we go. The session would go like this. I'll be briefing you about who we are and what we are. That is basically the Dino. And after that, my colleague Mr. Chidanand will be taking you with a little more detailed information on a particular product called lens.org. So I'll make it quick and crisp. At the end of the session, if anybody has any questions, you can feel free to pose it. Thank you. So Dino was earlier called as Van Scientific Information Limited. We have over 24 years of experience in sales and marketing of software, databases and healthcare solutions. We represent some of the largest international publishers in India. I'll brief you on which are the publishers in my next slide. We provide solutions for all the information and software needs of the healthcare, drug discovery, intellectual property, compliance and risk management community. We have a team of professionals with rich industry experience. We are present, we have offices in Bangalore, Delhi and Mumbai. We cater our solutions to these business segments, starting from academic and government, legal and intellectual property, online brand protection and domain management firms, drug and disease information to all the health sciences industry. These are some of the current partners that we represent. We have tied up with the IBM Watson Health for their evidence-based medication management solutions from Micromedex, the Central Link, the Cochrane Interactive Learning for their e-learning courses on how to conduct systematic reviews in healthcare. We also represent TMCH. TMCH stands for Trademark Clearing House, which is a subsidiary of ICANN, the governing council of the internet. L.R, this is our own product where it deals with the online brand protection and enforcement services. We also have Eisenwald, which is basically a document management software. And these are the other past partners with whom we have worked: NetNames, Waters Clovers, Chemixon, and Thomson Reuters. Coming to Micromedex, Micromedex is from IBM. They are the world leader in publishing evidence-based clinical decision support tools. With the experience of over 45 years, Micromedex is present in more than 95 countries across the world with more than 5,000 users. Some of the solutions are the medication management solutions, which comprises of drug information, in-depth comprehensive drug information, basically the drug monographs, the drug interactions, which would cover something like close to 13 types of interactions: drug, food, drug, alcohol, pregnancy, lactation, so on and so forth. We also have IV compatibility, where you can check whether a given combination of IVs are compatible or not. We have toxicology management solutions, where we cover about more than 1.5 million toxic exposure, with the treatment protocols, range of toxicity, the clinical effects, and so on and so forth. We also have the neonatal and pediatric information. We also have the patient care note. Patient care notes is basically the patient handouts given in the hospitals to the patients, where they give a brief information on what is the condition that the patient has, what is the medication that is being given, and the information is written in a very, very easy to understand language. They use 5th grade language so that the patient can easily understand. It's basically to improve the patient's outcome. The business models are available as on the user-based subscriptions to the referential content, or we also can provide the APS that can be where the drug data file can be integrated with the HIS system, or at the product level. Those who develop HIS, it can be integrated at the product level and given to the industry. We also support you with mobile apps for drug interactions, IV compatibility, and drug summary level information. The drug information searches are also backed by the IBM Watson's powerful artificial intelligence search engine. And Micrometrics is also accredited by the world's most reputed UK-based organization, that is NICE, which stands for National Institute for Health and Care Excellence. Next comes Cochrane. Cochrane, I'm sure many of you would know about this. They are the world leader in publishing the database of systematic reviews in healthcare. We basically represent they have come out with the e-learning courses on how to conduct systematic reviews. Okay, we represent that basically, and the course is of over 15 hours, which comprises of 11 modules, which is of self-directed, interactive, and very engaging learning content. The modules, like it starts with something like an introduction on how to conduct systematic reviews, writing the review protocol, searching studies, analyzing the data, interpreting the findings, reporting the review, and so on and so forth. The content is very dynamic, flexible, and very engaging. It gives clear explanations with stimulating interactions, quizzes, animations, examples, and reference resources. And after each module, students would be there would be assessment programs and the certification programs. Next comes the online, the L.R, which basically it may not be very relevant to you, but just you can always have this information, which is good. It is basically to do with online brand protection. Of late, you might have come across many companies whose brands are used by the fraudsters to create fake websites, post fake job offers, fake distribution offers, and all these things. We have the expertise in identifying such websites or domains, assess the threat level, and also bring down those fake websites. We work with companies where we can assist them with these things. Eisenwald, again, it could be very relevant to you because we have lots of institutions, hospitals, and many corporates who use. This is basically a robust document management software, and we have been ranked as one of the top 20 global document management software, basically a central repository for knowledge management. It provides fine-grained access control of each folder. You can set the rules to automate process such as filing and disseminating documents. You can set the alerts to notify you on the document expiry dates. You can run the audit trial showing all the activities that has been performed on each document, and it is available on both. It can be accessed both on web browser and mobile app based. So the last and the main thing is the lens.org. Basically, it's an open source platform for patent and scholarly knowledge articles. I would request my colleague to take on, to deep dive into this. Lens will give you more detailed information. Thanks.
.org is basically an Australian company. We are a small team of technologists and the academic thing. The founder is a professor of biotechnology. His name is Richard, and one of his invention with respect to biotech related aspect, when he did an academic study on that about 2 decades back, further it was picked up by some commercial companies and got into commercial exploitation of the same, whereas academic research didn't yield much there. So somewhere he thought the IPR has to be a little more justified in a way the research is conducted to keep all the research outputs as an open platform. So if you look at Lens as a philosophy, we always believe in open access to the research information. So today, Lens is an open platform for all your information requirements of discovery. If you look, once you go into lens.org, it will be a free platform for all of you to access as of now. In India, till the basic informations which are available. So mainly it has 2 sections of primary information dealing, only patents and also scholarly works. In the interest of this group, probably we'll go into the scholarly works. So what we are, how we do work, probably you can just dragged down. So these are the academic collaborations for us. Mainly we get our contents from Crossref, PubMed, Microsoft Academic, mainly in terms of scholarly works. Whereas it comes to patent related information, we derive our content from USPTO, eSpace, IP Australia and Whiteboard. These are the major sources of information. We also engage with other supporters, mainly with respect to core and others with respect to open source related aspects. How Lens is supported? Lens has been in the business for last 2 decades and it has been mainly supported through the philanthropic arms. So from the last year we are trying to make a move towards a commercial hybrid model. So that's where some of our offerings we have been making on a commercial basis, mainly with respect to denying access to the commercial exploiters. However, as on date, all academic institutions or institutions of public good will have a free access to our tools. So, getting into some of the questions which were discussed over the morning sessions and the first sessions here, Lens provides you a wonderful interface in terms of mainly looking from the discovery point of view. So as you see here, once so this is our scholarly interface. It has about 247 million records and there are about similarly 135 patent records. How do we get our content? Majority of it is coming from Microsoft, rest is the Crossref and PubMed and Co repositories. So you can run any simple searches for you. I was sitting there trying to do some research. Just for the interest of time, I think I got my spell wrong, sorry. So you can use it without any login. However, once you log in, you will get certain aspects in terms of search history. You can come back and go through your search histories. However, it has been long. We can save you thousands of search histories here. Also, there is a saved queries which help you to go back and send you alert systems what we are doing. So other thing is you can sort it by the relevance, sort it by citations, citation counts, citing patents, how the scholarly works have been cited in the patents, and the vice versa. That's a unique piece on the Lens where it will give you interconnection between what is scholarly works cited in the citation patents and also the patents, how they are citing the scholarly works. And also if you go down further here, there are quite a few filters where you can use certain filter mechanisms. I want to only see the ones which are under open access. You can select, refine your articles. So all this. Also, if you are interested in only clinical trials, you are looking for some funding for your specific research, you can go look for that particular, in dementia, if you look, who are the people who are funding. So those information are also available. Again, as my previous presenter had said, internet has issues. So basically, if you look down here, it will give you complete information about that specific record, whether it has open access, full text, it has author affiliation, field of studies and collections. Again, certain aspects in terms of if you are only interested in doing certain medical related aspect, use our subject matter field. It will give you mesh related subject headings to choose down. So I don't want to explain to this group what the mesh is. Other things available or mainly this subject is mainly related from the how that particular journal has been defined by the publisher in terms of subjects, what they cover. Field of study is purely an AI-based system where we have put an AI interface on top of all the literatures which we index, and it will automatically throw certain fields of study, and we will throw that subject field to you. And with respect to chemical substance name, it is not a structure name, structure drawing, but it's a purely chemical name related searches. These are again drawn from PubMed databases, and these are case sensitive. Be mindful of that. So as I said, this is the primary information discovery source for you in terms of all the discovery related aspects. So once you go into any particular collection, you can see the record level information. So here you can just see this is unique to lens record. It is derived from Crossref. This is a publisher. This is coming from PubMed. If you click, you can access full text PubMed related information for that. So based on information provided, you need not be getting annoyed whether it's a paywall related aspects or you have a free access, you can control it. Other part of our platform is mainly with respect to analytics. Lens helps you to build analytics dashboards. Go into the next tab there. So as soon as you enter, by default you will get certain pre-built dashboards for you. So these are highly customizable. 5 minutes I will take. So you can just clear this platform. Sure. Come down here. You can build your. There are predefined dashboards provided there. And if you do not like, you want to have a custom built dashboards, you can go back and build your own custom related dashboards. You want to see what is the publication over a period of time, you can just look at it. And all these are very intuitive, and clearly you can move from one chart type to another chart types. With the ease of a button. So most of your requirements would be addressed here. You can go through, analyze, citation related aspects you can pick up. How do you want to present it? Also, it helps you to get back and create your own collections, mainly with respect to your own works. Go here, select all the records, create a collection. You can define what the collection is and how do you want to set it up. Whether you want to look up for a static collection which is independent of future alerts that's going to come in, or you can opt for a dynamic collection which will help you to create and monitor those collections in the future. So that's in terms of collection. So there are other operators within the ecosystem, which is primarily pattern searches, scholarly. API data is something which is a subscription enabled thing that will help you to analyze bulk of data and visualization as well. PAT-seq is something, I don't know how many of you here deal with the sequence related information, mainly nucleotides, amino acids. So I won't go in detail there. PAT-site is something which is related to pattern citation and scholarly citation analysis, which will provide you a vector analysis. You can look at it. And you can also build in many kinds of reports which would be very useful for your academic searches on the platform itself. These are built using our own internal report mechanisms. So feel free to take your time and explore the platform. However you wish, you can build in all the factors, and this is about mainly we were building it for the CSIR, including about the 50 plus labs, how their research output is, how the citation intensity of it is, and how the CSIR is open access related information. One good reference point for any of the researcher is when you are making your own articles open source database, the citation counts are comparatively higher when it is non-open. So those are the insights you can always develop. And if you have any questions for 2 minutes, I would be happy to take, or else we will be available for you for any questions and answers.
Now call upon stage the representative of Balani Infotech Private Limited for his product presentation.
My name is Arjun from Balani Infotech Private Limited and I Group India Infotech Private Limited. So today we are promoting 3 products: Science, ACS and Trinka. So they are not doing what they are doing. Yeah, this is all about Balani Infotech. So most of the people know about this, so I don't want to take much time on this. So just straight away we'll go to the publisher. This is a society publisher, American Association for Advancement of Science. So we have 6 different journals in science platform. One is Science, Science Robotics, Science Advances. Science Advances is an open access journal. Science Signaling, Science Immunology and Science Translation Medicine. So most of the journals are related to medical and allied sciences only. So you can have a look on this. Yeah, these are the details of this particular journal. So next I would like to mention on American Chemical Society. So basically we felt that ACS is majorly into chemistry and physical, like in chemistry departments. So now we have come up with few titles on medicine also, like medicinal chemistry, medicinal chemistry letters, health and safety. So 5 to 6 journals we have launched in American Chemical Society. This is one of the premier society, and here in this we have more than 64 journals as of now and 1600 plus ebooks. Today means completely in all the subject areas. So this is what I just mentioned, and some of the subject areas we have mentioned here, major. So this one I would like to mention. This is the product called Trinka. So recently we got associated with this product. So this is a purely Grammarly tool. This is an Indian based product from Mumbai. This product came from Enago platform, and it's completely driven through AI. So this is how it works. So Trinka was born in named by Trinka D. Puna from Goa itself. It's built on 15 plus years of Enago's editorial experience. As just I mentioned, Enago platform. And already we have more than 2 million users worldwide. And these are the plugins: Cloud, Enterprise, this one, browsing plugin and MS Word plugin. So what Trinka checks? So it's all these two. So style guide preference, word count, reduction, unbiased language, vague language, technical phrasing, academic tone, and others. So apart from this, auto-edit MS Word document, consistency checker, publication check, subject area based corrections, all these options available in Trinka platform. So now we are working on the trials and demos with most of the customers. So still we have not pushed this product to the market. So recently we are there. Yeah, that's all from our presentation. Thank you very much.
To give a memento to Dr. Medha Joshi. I apologize. I request Dr. Medha Joshi ma'am to give a memento to Dr. Kiran, who has presented a paper. Thank you, sir.
I request Mr. Narayana, EC member KHSLA, to give the memento to Dr. Medha Joshi ma'am. Thank you, sir. Thank you, ma'am. I request Dr. Prakash, Treasurer, KHSLA, to come on the dais. Thank you, sir. I now request Dr. Shashikala, ma'am, Joint Secretary, KHSLA, to present the memento to Mr. Manjunath Yaligar, sir. Thank you, sir. Thank you, ma'am.
Now, let's take a tea break of 10 minutes and come back for the technical session 3. Thank you.
I invite Mrs. Shashikala Kainur, ma'am, librarian, A.P. Shetty Memorial Institute of Dental Sciences, deemed to be University, Bengaluru, to begin the session as a chairperson. Next, I invite the co-chairperson, Mr. Narasimha Murthy, A.B., librarian, Dayanand Sagar College of Dental Sciences, Bengaluru, to grace the dais.
I now request Ms. Lakshmi Chalageri, librarian, Kings Hubli, to grace the dais as a reporter. As Mrs. Lakshmi Chalageri ma'am is not available, I now request Dr. Shashidhar sir from Ramayana Dental College to grace the dais as a reporter. I now request Dr. Shashidhar sir, Ramayana Dental College, to grace the dais.
This session is about the e-learning or virtual learning resources modules in health science sector. We all know that due to the past 2 years, due to the COVID pandemic, most of the health science classes were held in online, and the role of libraries are also equally important in this regard. Now I call upon Mr. Navin A.S. His paper is analysis of open access channels of health science in DOAJ.
First, I would like to thank you for RIMS-RAICHUR Institute of Medical Science and KHSLA. My name is Navin K.S., Chief Librarian, Superintendent of Medical Science, Shimoga. My topic is analysis of open access publication of health science DOAJ and overview. Outline, introduction and DOAJ, scope of methodology, analysis and interpretation of data, finding and conclusion. Introduction. Open access journal and self-archives are two parallel ways of AO. Open access journals make published article immediately available free of their website, a strategy of that largely founded by author of fees, usually through the research grant. Open access publication as well as authors' opinion on the available options while developing new statistics. Scope and methodology. DOAG, which was launched in the 2003 at Loud University, Sweden. It was started with 300 open access journals. Today it contains 17,480 open access journals, 72,64,374 articles, and 132 countries have been contributed their scholarly literature in DOAG. It's cover all areas of science and technology, medicine, social science and humanities. health science has been entered in the search box of the DOAG website. A total 182 journals related to health science are reviewed, retrieved, and distribution of peer-reviewed journals of long range. Table 1 shows the majority of journals have been published in the English language, 58.24%, followed by Spanish, Portuguese. The data presented in the table also shows that very less number of health science journals, 0.054%, published in Romania. The contribution of health science journals by top 15 countries. The contribution of health science journals different countries in the presented in the table 2. It can be seen from the table that majority of journals have been published from the Brazil, 13.18%, followed by the Indonesia and United Kingdom. The table also shows that very less number of journals published by Cuba, and the number of journals added to the DOAG in the year. And table 3 reveals the number of journals added in the DOAG in different years. Majority of the journals were added in the year 2017, 15.93%, and year of 2020, 15.38%. It also observed from the study that 12.63% of journals were added in the 2016, and 10.98% journals were added in the 2015. The table also shows the very less percentage of journals have been added in the 2009, 1.6%, and 2008 is 0.54%. The top publishers published in the health science journals open up in DOAG. In this table shows the number of health science journals published by the various renowned publishers among the top publishers. The majority of journals are published by the author publisher, 73.94%, elsewhere by Waterscroll, Medno publication 3.36%. The study has also found the very less percentage of journals published in University of Arlington. And peer-reviewed journals, peer-reviewed types of health science journals, blind peer-reviewed and double-blind peer-reviewed, open peer-reviewed, and peer-reviewed post-publication peer-reviewed. This table shows the number of health science journals that publish peer-reviewed articles. Double-blind peer-reviewed is used by the majority of journals, 51.64%, followed by blind peer-reviewed, 25.27%, and peer-reviewed, 20.87%. Very low percentage of peer-reviewed is post-publication peer-reviewed, 0.54%. Finding and conclusion: the majority of the journals have been published in the English language, 58.24%, followed by the Spanish. The highest number of journals added in the year in 2017 and 2020. The majority of health science journals that published peer-reviewed article double-blinded peer-reviews is used by the majority of journals, 51.64%. The director of open access journals needs to increase the visibility of research use and open access scientific and scholarly journals, thereby promoting their increased usage of impact. The research scholars, scientists, professionals should browse the DOAG site and access free online journals on their subject area. It is also suggests that scientists and research scholars should publish the research work online. Open access journals for wider visibility of the research work and for degrade the impact factor of the citation index. Thank you.
We can ask at the end. Now I call upon Mr. Dashrath B. Bandage. His paper is Open Access on the Scientific Literature to Medical Libraries.
I am apprehending my topic, Open Access of the Scientific Literature to Medical Libraries. So abstract. This is the abstract of my paper. The abstract reviews and analyzes the evaluation of the open access scientific publishing movement and its impact on the traditional scholarly publishing, including blackness institutes. A literature survey, historical developments and definitions, the funding agency takes responses to viewpoint of NIH, Government Central Repositories and Publishing. So this is the introduction. In the information society, the free flow of information is a fundamental principle for the connecting the knowledge gaps between privileged and underprivileged communities. Social inclusion and economic empowerment are also achieved in the society where citizens have universal access to information and knowledge ranging from public information to specialized or customized information related to one's profession, vocation or culture. In an open access environment, there are two main components called open access publishing, self-archiving of articles, open access archives. The open access initiative is a gaining movement due to the worldwide availability of advanced digital tools, online publishing platforms, systems and several declarations and initiatives, including Plan S, have already laid a foundation for moving away from subscription to full and immediate open access scientific publishing. The Director of Open Access Journals and PubMed Center currently free searches of open access sources. Survey of literature. Since the funding of philosophical construction in 1665, journals have been the vehicle of choice for the dissemination of scientific knowledge. Over the years, the number of active peer-reviewed learned journals has expanded and collectively publishing more than 1 million of articles per year. Most of these journals are accessible by subscription, and before the mid-1990s, they were available only on paper. The end of the 20th century, most of journals had moved their content to online platform, greatly increasing the accessibility of scientific information in the present day. Several new open access journals are available. On May 2, 2005, the National Institute of Health initiated a program to provide the public with access to the research to investigators with support. The agency asked NIH-funded authors to deposit their peer-reviewed manuscript voluntarily into PubMed Central, a full-text repository. Within 12 months after the journal subscription, open access include PubMed Research Strategy, open access publishing, or open archiving, or in institutional repositories. The United States National Institute of Health Public, NIH Public Access Policy, the more extreme benefits of open access believe that scientific literature should be free up to the readers. So in 2018, a radical Plan S initiative was launched at the 12th Berlin Model of Open Access Conference in 2015 to achieve a sustainable model of open access publishing by converting resources of journal subscription. The Plan S was put forward by a coalition of 11 European grant funders and large non-commercial publishers to accelerate from a subscription to open access publishing model by January 2020. The plan implies that public funded research should be freely available immediately open publication. So history and definition of open access. The open access movement gained further momentum in 1998 with the funding of the scholarly publishing and the academic research by
This one, I think, history and definition.
Okay. This is okay. Definition. So this is the definition of open access. According to the Budapest Open Access Initiative, research literature should be available free on the internet, permitting any users to read, download, copy, distribute, print, search, or link to the full text of these articles, browse them for indexing, pass them as data to software, or use them for any lawful purpose without financial, legal, or technical barriers. Other than these, inspirable from gaining to access to the internet itself, and open access publishing was consulted by the National Library of Medicine of the US and reflected in the open access publishing keyword of the medical subject heading list. What is the open access? So you know everybody what is the open access. Sorry, again I am going to the next step. So types of open access. So open access now comes in two flavors, gold and green. Gold open access, also known as self-archiving. Open access literature is produced and how it can be disseminated to the research community in digital form through free available online through internet direct open access publishing is often called self-archiving. There are 2-3 channels, mainly on the internet, to disseminate open access literature, namely author's personal website, disciplinary and subject archives and institutional repositories. Self-archiving by the authors can do both preprints because E&C retained copyright only granted certain non-exclusive rights to publishers, preprints under specific terms and conditions. Gold open access provides immediate free open access to the literature. The cost of publications are covered by the author, processing or publication charges. Green open access journals, also known as open access journals. So open access journals require the authors to deposit a peer-reviewed manuscript such as PubMed Center. The public repository is covered through subscription fees, but the content is generally made available free of charge on the embargo period. So the following open access links are available here. The Biomed Center. The Biomed Center is the largest open access journal publisher. It is a new venture started for the purpose of open access is called Burn Open Access Publishers. Biomed Central is a non-profit digital publishers access, especially for open access journals using Creative Commons attribute license for their publications. Second one is the Public Library of Science, PLOS. PLOS is a non-profit open access publishers empowering researchers to accelerate process in science and in medicine by leading a transformation in research communication. The third one is the Journal Directory. So please, our friends also explain about the DOAJ. So DOAJ comprehensive list of open access journals is all subject areas is maintained by the university plan by Directory of Open Access Journals. This directory serves cover the full text quality, controls scholarly journals. So this is the very important of the scientific literature to the open access. So preprint is the open access repository where others deposit preprint, postprints are both. Then the dual model access, both print to subscription and open access journal editions offer, delayed access, open access editions available some months after initial publication, author fees, so partial access, then low income access, indexing access. So silent feature of the open access literature. Open access literature is freely available. So open access literature is online and it is available on internet. Open access literature is scholarly work. So first term, this is a royalty-free literature. Fourth one is the authors of this work are not paid for their efforts. The fifth one is most of the peer-reviewed journals articles are not paid, but not all. Such works are scholarly. These articles are identified as primary types of open access literature. Sixth one is the users can copy and distribute open access work without any constraints. The segmentation of permission barriers is different from the different works. So this is the institutional repository. Institutional repositories IRS are developed for the management of an institutional digital assets which can include digitized and burn digital tags, audio, images, multimedia, and data sets supporting. Okay, coming to the conclusion. Okay, this is the Director of Open Access Repositories, PubMed Central. The role of the NLM. The NLM plays an important role in the biological discovery significant. It ensures instant electronic access to the world biomedical literature, stored in PubMed and indexed through a unified medical knowledge systems, UMLS. An integration of more than thousands of biomedical technologies, its sisters resources, PubMed Central, serves as a free archives of full-text biomedical articles within NLM. The National Center for Biomedical Information (NCBI) not only houses in sequence databases but also created the methods that links genomics and phenomics structures. Three functions of the NLM are important here: indexing, creating standard methods of knowledge, description and representation in the machine-readable form, including indexing, computations, ensuring efficient interface and tools and distribution, making result visible. So conclusion, providing access to information is a basic tenet to the librarianship. Ranganathan's classic work, The 5 Laws of Library Science, calls upon libraries to make information widely available and easily accessible to all peoples. While Ranganathan's work refers to books, these principles hold true regardless of the format and the information and can be seen in the fields of support of the open access movement. So open access application costs covered through subscription fees, but the content is generally made available free of charge after a more cooperative. So thank you very much. So this is my references.
Thank you for your elaborate presentation. Now I call upon Dr. Yakub Johnson. His paper is Impact on COVID-19 on Mobile Technology, Innovations and Applications in Libraries. Yes, his paper is.
Good evening to everyone. Today is the user and services are in a burning topic over here. But we come to the end session, that is today's session, as a e-learning tools and technologies in medical science. My colleague S. Shaila from Age Institute of Medical Sciences, Mangalore, in her absence, I myself, John Sip from Medical Training Center, Bangalore, presenting this paper. In today's e-learning, the term e-learning is a comprehensive concept that involves the use of all kinds of electronic media and information communication technology in education. E-learning is commonly referred to the intentional use of network information and communication technology in teaching learning. A number of terms are also used to describe the teaching and e-learning in the tools and technology. The characteristics is like this. Today's e-learning is still an early stage with many uncertain issues to be clarified and investigated. E-learning is a promising alternative to the traditional classroom, which is especially beneficial to the remote and lifelong learning process. In many cases, e-learning can be significantly complement classroom learning. E-learning will keep growing as an indispensable part of the academic and professional education. It has got two basic common e-learning modes, that is digital learning and computer assisted instruction. Distance learning is nothing but the uses of information technology to deliver from one place to another to your learners at remote locations. Computer assisted instructions uses computers to the aid in the delivery of standalone multimedia packages of learning and e-learning of teaching. E-learning and tools and technology, most developers still use HTML, JavaScript, Flash and other standard tools for the e-learning software. But all e-learning developers don't access to programming support, or they don't want to restrict it to the simple HTML. This need has given rise to the varied number of commercial as well as the open source software products that could be used as a specialist e-learning authoring tools. This e-learning tools has got blogging tools. Blogging tools to create and write a weblog with bibliotool.com, and the blogger is blogger.com or start.com. In these collaboration tools can be categorized in two categories, that is application sharing and then exchange conferencing server. In this audio conferencing, let the participant talk with each one to another, or multiple users can talk at a time. Each conferencing server and exchange, robot audio tool, chat, instant messaging and email, and exchange conferencing server, Squill Mail, chat space community server. The online discussion video conferencing. Online discussion video conferencing allow user to post messages to know location where other participants can read and respond to them, while video conferencing tool let the user see, also hear one another. There is discussion on app, list manager, video conferencing tool, web tool, multicity, valor package, whiteboard, group board. In the content kernel, in e-learning tools and technology, content converters are there. File format converters can convert multiple files into one format to another. Batch converter and the QuickTime Player Pro and the content management system. In these tools do the task managing and reissuing all types of information content. That is author IT and then user learned 4th year. In the learning management of e-learning tools and technology, simplified the process administering and training. The primary function is to offer a collection of courses and rank with the course learning. There are many links that have been projected over here. Now we will come to the merits. There is no time to spend. Committing to class with the courses can be availed from physically remote location, provided internet connectivity in town. As in the COVID period, there were the online classes have been conducted. No travel costs are involved in the e-learning medical education. One can have the job or pursue some other interest while one attends such courses. In its demerits, there were many demerits to learn in the effective online instructions and to convert face-to-face contents online. Confidence and attitude are likely to develop over the time and the training period. Need for suboptimal time management, that is both student as well as the faculty interaction session. Internet connectivity or access of problem. Yes, in the morning, the chief guest also was mentioning about in the initial period there was a dialing systems. Through that, it has been developed into the Wi-Fi system. In a fraction of seconds, now we can extract the information. More time consuming for the instructor to provide individualized feedback. Many times this is very impossible for getting the feedback at many times. Need for ongoing technical training and the support of learners and instructors. As I said, academic honesty of the online students is difficult to monitor since it is in the online process. Need for various types of effectiveness of assessments, lack of face-to-face interactions, equality of access to learners of all backgrounds and parts of the society, requires new skills and responsibility from learners, does not provide many social aspects of a true campus or traditional classroom, wanting enthusiasm and ignorance. E-learning in medical, in the technical tools and technologies. As for concern to medical science and education, e-learning takes very important part in the education. E-learning is nothing but a computer or it is also described that the internet supporters are the web learning processors. As we know, until 2000, most of our education systems was in a classroom oriented. Due to COVID, it has been shifted to the online. In the e-learning has changed the role of medical sciences, education and librarian. Especially, this is important for our library professionals. One of the main changes occurred the strategy process of stronger orientation in medical science library. Medical science library plays a very important role in the e-learning process. Since beginning we are talking about the learning process. It's supposed to be used in the e-learning and distance education on orientation of a building virtual institution. Librarian also can play a significant role in this process. Librarian can integrate information resources and e-learning. Librarian can find out the new tools with enhanced learning process and can provide to use when required, user to the required. This will update the library information searching process and possibilities to develop e-learning teaching and possibilities. Library can conduct a face-to-face conversation or communication towards the e-learning training and education. To conclude myself, e-learning allows for efficient transfer of knowledge and real-time process, while at the same time the empowering learners with the transformation technology, awareness and skills crucial to succeed the present knowledge revolution that is digital era. All the resources are created in electronic version and almost all the resources transfer from physical to the electronic form. The concept of education system is also changed. E-learning confronts with the traditional education system. The e-learning will be one of the hottest new technology area. Within the next few years, Learning Education Center and also play a vital role in e-learning education. Thank you, sir.
Any questions, any suggestions, or your opinion, please. Because in the pandemic time, it is very peaceful to divide open resources. Okay, thank you.
Call upon the representative of CBS publishers and distributors to come on the dais and present this product.
Good evening all. My name is Shiv Jiran. I am from CBS Publisher, but the site was Eduport Global Private Limited. It is an initiative of CBS Publisher wherein we have published e-books. E-books means not only the reference but the core textbooks what we published in print. We have converted into e-books and these are available. CBS, it's a 3 decades company and well known in the publishing market. And Eduport Global Private Limited is the initiative of CBS Publisher wherein 1700 e-textbooks, I'm talking about core textbooks in medical, engineering, agriculture, food science, complete STM. And these books are available at, very cost-effective subscription and perpetual access also. So I will not take much time. I'll take this opportunity to tell you that from morning in repeated sessions there was a discussion about the content for PGs and undergraduates. Yes, we were talking about consortium, journals, PGs, but undergraduate it was a concern. So here we have textbooks which will serve the complete MBBS course, which will come. These are the subject categories where we have textbooks in e-version, which could serve complete MBBS, PG, undergraduate students. So coming down to benefits, this will be accessible 24/7. Personal bookmarks, highlights and notes facilities will be available. Subscription as a chosen perpetual and subscription model is also available. It is a multi-user concurrent access model, completely searchable with rich text, tables and high quality images. Offline reading facility available through an encrypted format via easily downloadable iPublish Central Reader app, user-friendly ebooks and text-to-speech available in iOS users thing. So now, how to access these books rather than showing the slides, I would like to show you. This is our home page, eduport-global.com, from where we give access to our e-textbooks. And where this access is given on IP based as well as user ID and login, user ID and password based. So here, So here you come. Here you have, search facility. West or any publisher, it is a user-friendly. The site will be user-friendly. I don't want to take much of a time. Only the thing I want to show you that offline how you can read the book. That is the main interest I have brought you here. Here it says download the app easily. From here you can download, or you can go to a Google Play Store and download. And once you have downloaded that, you can, whatever the books you download from this site after getting logged in, you can read it offline also, like without internet also. That I'll show you. I have downloaded some books into the same app, which I have kept ready before the presentation. So these are the books I have downloaded minutes back over here to cut down the time in presentation because we are running short. And here, even if I switch off the internet, you can open the book and read it as you are reading online. And as I told you, these books, I think all of you from medical health science library, these books are very familiar to you, which are very much adopted and accepted as a core textbooks in many of the colleges. And these books are available as textbooks. And there is a need for a content for undergraduates, and there we have. And this is what I just wanted to convey. And I get on with the presentation. Thank you very much. If anyone has any questions.
What is the subscription cost? What's the cost of the package?
So we do, as I told you, we do have two kind of subscription. One is subscription, one is perpetual. And perpetual will be depending on the complete package or a pick and choose. If you go for a pick and choose, minimum 25 titles you have to choose. And based on those titles, we can give you the pricing. As such, there is no fixed price available.
At least minimum you tell me, because we have to approach our higher authority, no? So sure. If you go for 25 titles, how much it costs?
It depends each title. See, package. If I talk about BD 84, it will be 2095%. Yeah. Single title will be 500. Which titles you will be selecting based on those MRP, again we work out the price. See, it is.
Hello.
Approximately pricing, I'll let you know, but don't take it as a confirmed price. Medical collection, we have 560 titles. It may cost around 32 lakhs, 24,000.
See, most of the undergraduate books are covered from the CBS.
Sorry, sir?
CBS. So, according to my experience in medical, anatomy is covered most of the 20-25% of the books from CBS. And especially for pre-clinical, it will cover. According to your experience and knowledge, so how much the cost per minimum cost?
Minimum 25.
Yeah.
So that is what I am explaining you. If I can send you the list, you choose the titles, then I can tell you the price.
Hello, approximately.
That's my email ID. If anyone has any queries, you can directly write to us, or you can reach to any of the CBS office, which you already have contact representative contacts. You can get in touch with them. Thank you.
Oh, very nice. Good to see so many people over here in the evening. Because we are in Karnataka, we are in RIMS-RAICHUR, most of you understand Kannada or prefer Kannada. I would rather speak in Kannada only. Okay. Yakandre, we recorded one video in English and in Kannada. Kannadalli record ಮಾಡಿದ್ದು ಒಂದು ವಾರದಲ್ಲಿ 2 ವಾರದಲ್ಲಿ 100 ಹಿಟ್ ಬಂದಿದೆ. ಇಂಗ್ಲಿಷ್ ಮಾಡಿರೋದು 1 ವರ್ಷ ಆದರೂ 2 ದಾಟಿರಲಿಲ್ಲ ಅದಕ್ಕೆ. So now I understand while it's better to speak in Kannada. ನಾವು 25 ವರ್ಷದಿಂದ ಕಾಲೇಜಲ್ಲಿ ಓದಬೇಕಾದ್ರೆ ನಮ್ಮ ಗ್ರಂಥಾಲಯದ ಮೇಲೆ ಹೆಸರಿತ್ತು ಗ್ರಂಥಾಲಯ ಅಂತ ಬರೆದಿತ್ತು. ಬಟ್ ಈಗ ನಾವು ಯಾವುದೇ ಗ್ರಂಥಾಲಯಕ್ಕೆ ಹೋದರೆ ಗ್ರಂಥಾಲಯ ಮತ್ತು ಮಾಹಿತಿ ಕೇಂದ್ರ ಅಂತಿದೆ. ಲೈಬ್ರರಿ ಅಂಡ್ ಇನ್ಫಾರ್ಮೇಷನ್ ಸೆಂಟರ್. So let me ask you a question now. So now, isn't it a good idea that librarian should become a chief information officer? Because you are the custodian of information, no matter what it is related to the college. ಈ ಕಾಲೇಜ್ ಯಾವುದೇ ಇನ್ಫಾರ್ಮೇಶನ್ ಇರ್ಬೋದು ಅದಕ್ಕೆ ನೀವು ಕಸ್ಟೋಡಿಯನ್. ಸೊ ಅದಕ್ಕೆ ನಾವೇನು ಮಾಡಿದ್ದೇವೆ ಅಂದರೆ ಈಸಿಲಿಪಲ್ಲಿ ಬರೀ ಗ್ರಂಥಾಲಯಗಳಿಗೆ ಮಾತ್ರ ಈಸಿಲಿಪ್ ಸಾಫ್ಟ್ವೇರ್ ಆಗಿರಬಾರ್ದು, ಅದರ ಜೊತೆಗೆ ಮಾಹಿತಿ ಅಂದರೆ ಈ ಎಜುಕೇಷನಲ್ ಇನ್ಸ್ಟಿಟ್ಯೂಟಲ್ಲಿ ಯಾವುದೇ ಮಾಹಿತಿ ಇರಬೇಕು ಅದು ಲೈಬ್ರರಿ ಒಳಗಡೆ ಬರಬೇಕು. ಸೊ ಅದರ ಸಲುವಾಗಿ ವಿ ಹ್ಯಾವ್ ಎಕ್ಸ್ಪ್ಯಾಂಡೆಡ್ ದ ಸ್ಕೋಪ್ ಆಫ್ ದ ಲೈಬ್ರರಿ ಸಾಫ್ಟ್ವೇರ್. ಈಸಿಲಿಪ್ ನಾವು ಇಟ್ಸ್ ಕಾಲ್ಡ್ ದ 7.2, ದ ನೆಕ್ಸ್ಟ್ ವರ್ಷನ್, ವಿಚ್ ಕವರ್ಸ್ ಆಲ್ ದೀಸ್ ಥಿಂಗ್ಸ್. ಸ್ಟೂಡೆಂಟ್ ಇನ್ಫಾರ್ಮೇಷನ್ ಇರ್ಬೋದು, ಸ್ಟಾಫ್ ಇನ್ಫಾರ್ಮೇಷನ್ ಇರ್ಬೋದು, ಅವ್ರ ಅಡ್ಮಿಷನ್ಸ್ ಇರ್ಬೋದು, ಅಟೆಂಡೆನ್ಸ್ ಇರ್ಬೋದು, ಫೀಸ್ ಕಲೆಕ್ಷನ್ ಇರ್ಬೋದು, ಸರ್ವೆಗಳು ಮಾಡ್ತೀರ ನೀವು ನಾಕ್ ಅದನ್ನ ಇರ್ಬೋದು, ಬಾರ್ಕೋಡು, ಲರ್ನಿಂಗ್ ಮ್ಯಾನೇಜ್ಮೆಂಟ್ ಸಿಸ್ಟಮ್, ಅಟೆಂಡೆನ್ಸ್ ರಿಕಾರ್ಡ್, ID ಕಾರ್ಡ್, ಇಮೇಲ್, ಇನ್ವೆಂಟ್ರಿ ಟೇಬಲ್, ಕುರ್ಚಿ ಅದೆಲ್ಲ ಇರುತ್ತಲ್ಲ, ಅದರ ದಟ್ ಇಸ್ ಆಲ್ಸೋ ಇನ್ಫಾರ್ಮೇಷನ್. ಹೂ ಶುಡ್ ಬಿ ದ ಕಸ್ಟಡಿಯನ್ ಆಫ್ ದಟ್ ಇನ್ಫಾರ್ಮೇಷನ್? Library. Okay, as whether you define the scope of the library as books and the digital content, or you want to define the entire information, is up to you. Okay, even inventory, visitor management, transport to CRM. CRM stands for customer relationship management. Here in case of SRM, student relationship management. Amale examinations, alumni management, library, the traditional library. Amale placement to last year facility management. I would have loved to show the live demo. ಇಲ್ಲಿ ಇಂಟರ್ನೆಟ್ ಕನೆಕ್ಟ್ ಆಗ್ತಾ ಇಲ್ಲ, ಸೊ ಐ ಟುಕ್ ಸಮ್ ಸ್ಕ್ರೀನ್ ಶಾಟ್ಸ್, ಅದನ್ನ ತೋರಿಸ್ತೇನೆ. ಓಕೆ, ಇದು ನಿಮ್ಮ ಹೋಮ್ ಪೇಜ್. ಈಗ ನೀವು ಲೈಬ್ರರಿ ಈಸಿಲಿಪ್ ಕಸ್ಟಮರ್ ಆದ ತಕ್ಷಣ ಇಲ್ಲಿ ಮೇಲೆ ಈಸಿಲಿಪ್ ಲೋಗೋ ಬದಲಾಗಿ ನಿಮ್ಮ ಕಾಲೇಜ್ ಲೋಗೋ ಬರುತ್ತೆ, ಕೆಳಗೆ ಒಂದು ಕಡೆ ಚಿಕ್ಕ ಕಡೆ ಈಸಿಲಿಪ್ ಅಂತ ಕಾಣಿಸೋದು, ಆಮೇಲೆ ನಿಮ್ಮ ಕಾಲೇಜ್ ಹೆಸರು. ಟ್ರೆಡಿಷನಲ್ ದಿಸ್ ಇಸ್ ಸ್ಟಿಲ್ ದ ಲೈಬ್ರರಿ ಸಾಫ್ಟ್ವೇರ್ ವಾಟ್ ಯು ಆರ್ ಸೀಯಿಂಗ್. ಫಿಸಿಕಲ್ ಕಲೆಕ್ಷನ್. ಓಕೆ, ಸೊ ಈ ಇದೇನು ಕಾಣಿಸಲ್ಲ, ಫೋಟೋ ಗ್ಯಾಲರಿ, ಅನೌನ್ಸ್ಮೆಂಟು, ಎಕ್ಸ್ಪ್ಲೋರ್ ಎಲ್ಲಾನು ನೀವು ಅಪ್ಡೇಟ್ ಮಾಡ್ಬೋದು. ಈಗ ನಮಗೆ ಕಾಲ್ ಮಾಡಿ ಅದನ್ನ ಟಿಕೆಟ್ ಓಪನ್ ಮಾಡಿ ಅದೇನು ಬೇಕಿಲ್ಲ, ಡೈರೆಕ್ಟ್ ಆಗಿ ನಿಮ್ಮ ಲೈಬ್ರರಿನ ಅಪ್ ಟು ಡೇಟ್ ಇರ್ಬೋದು. ಡಾಕ್ಟರ್ ರಂಗನಾಥ್ ಅಂತ ಹೇಳಿದ್ರೆ ಲೈಬ್ರರಿ ಇಸ್ ಎ ಗ್ರೋವಿಂಗ್ ಲಿವಿಂಗ್ ಆರ್ಗನಿಸಮ್. ದಟ್ ಮೀನ್ಸ್ ಇಟ್ಸ್ ಮೂವಿಂಗ್, ಇಟ್ಸ್ ಗ್ರೋಯಿಂಗ್. ಎವ್ರಿ ಟೈಮ್ ಎ ಸ್ಟೂಡೆಂಟ್ ಕಮ್ಸ್ ಇಟ್ ಶುಡ್ ಲುಕ್ ಸಮಥಿಂಗ್ ಡಿಫರೆಂಟ್. ಸೊ ಅದನ್ನ ಯು ಕ್ಯಾನ್ ಕೀಪ್ ಇಟ್ ಅಪ್ಡೇಟೆಡ್. ಸೊ ದಿಸ್ ಇಸ್ ಸಿಮ್ಯುಲೇಟಿಂಗ್ ದಿ ಫಿಸಿಕಲ್ ಲೈಬ್ರರಿ ಇನ್ ಲೈಬ್ರರಿ. ಸುಮ್ಮನೆ ಸಿಂಪಲ್ ಆಗಿ ಹೋಗ್ಬಿಟ್ಟು ಎಷ್ಟು ಬುಕ್ ಇದೆಯಪ್ಪ ಲೈಬ್ರರಿ ನೋಡಿದ್ರೆ ಎಲ್ಲ ಲಿಸ್ಟ್ ಬಂತು, ಐ ಕ್ಯಾನ್ ಸರ್ಚ್ ಅನ್ನೋ ಟೈಟಲ್ ಆ ಥರ ಪಬ್ಲಿಷ್ ಏನು ಬೇಕಾದ್ರೆ ನಾನು ಬಿಲ್ಡ್ ಮಾಡ್ಬೋದು. ಆಸ್ ಎ ಸ್ಟೂಡೆಂಟ್ ಲುಕ್ ಅಟ್ ದ ಟಾಪ್, ಐ ಆಮ್ ಸೀಯಿಂಗ್ ಓನ್ಲಿ ವಾಸ್ ಅಂತ ಕಾಣಿಸ್ತಾ ಇದೆ, ನಾನೀಗ ಸ್ಟೂಡೆಂಟ್ ಆಗಿ ಆಗ್ತದೆ. ಓಕೆ, ಇದರ ಮುಂದೆ ಲೈಬ್ರರಿಗೆ ಇನ್ನೂ ಫೆಸಿಲಿಟಿ ಇದೆ. ಏನಿದೆ ಅಂದರೆ ಇದನ್ನು ಕ್ಲಿಕ್ ಮಾಡಿಬಿಟ್ಟು ನೋಡಿದ್ರೆ ಯು ಕ್ಯಾನ್ ಈವನ್ ಶೇರ್ ಎ ಫೇಸ್ಬುಕ್ ಪೇಜ್. ಇವತ್ತು ಮುಂಜಾನೆ ನೋಡಿದ್ವಲ್ವಾ, ದ ಪ್ರೊಫೆಸರ್ಸ್ ವಾಂಟ್ ಟು ನೋ ಹೌ ಟು ಆಕ್ಸೆಸ್ ಲೈಬ್ರರಿ, ವಾಟ್ ನ್ಯೂ ಐಟಮ್ಸ್ ಹ್ಯಾವ್ ಕಮ್ ಇನ್ ಟು ದ ಲೈಬ್ರರಿ. ಅದಕ್ಕೆ ನೀವೇನು ಮಾಡ್ಬೋದು, ಯು ಕ್ಯಾನ್ ಓಪನ್ ಎ ಫೇಸ್ಬುಕ್ ಅಕೌಂಟ್, ಲಾಗ್ ಇನ್ ಟು ಈಸಿಲಿಪ್, click on share on Facebook, and EasyLib will post the message to the share Facebook. It could be Facebook, Twitter, YouTube, ಅಥವಾ ಯಾವುದಾದ್ರು ಇಮೇಲು, SMS, anywhere you can share what all information you have in the library. ಆಮೇಲೆ ಉಳಿದ ಸರ್ಚ್, ಕೀವರ್ಡ್ ಸರ್ಚ್ ಇದೆ, ರಿಸರ್ವ್ ಫೆಸಿಲಿಟಿ ಇದೆ, ರಿನ್ಯೂ ಫೆಸಿಲಿಟಿ ಇದೆ, ಎಲ್ಲ ಫೆಸಿಲಿಟಿ ಸ್ಟೂಡೆಂಟ್ಗಳಿಗೆ ಉಂಟು. ಓಕೆ, ನೆಕ್ಸ್ಟ್ ಇಲ್ಲಿ ನೋಡಿದ್ವಲ್ವಾ, ಇದು ಹೋಮ್ ಪೇಜಲ್ಲಿ. ಎರಡನೇದು ಕಾಣಿಸ್ತಾ ಇರೋದು ಡಿಸ್ಕವರಿ. ಡಿಸ್ಕವರಿ ವಾಟ್ ಇಟ್ ಮೀನ್ಸ್, ಒಂದು ಋಗ್ವೇದದಲ್ಲಿ ಐ ಡೋಂಟ್ ರಿಮೆಂಬರ್ ದ ಎಕ್ಸಾಕ್ಟ್ ಸಂಸ್ಕೃತ ಗೊತ್ತಾಗ್ತಲ್ಲ, ಲೆಟ್ ದ ನೋಬಲ್ ಥಾಟ್ಸ್ ಕಮ್ ಫ್ರಮ್ ಆಲ್ ಡೈರೆಕ್ಷನ್ಸ್. Discovery is nothing but once a student searches on some title, it goes across all the journals in the world. ಎಲ್ಲ ಜರ್ನಲ್ ಎಲ್ಲೇ ಪಬ್ಲಿಷ್ ಆಗಿರಲಿ ಅಲ್ಲಿಂದ ಸರ್ಚ್ ಮಾಡ್ಕೊಂಡ್ಬಿಟ್ಟು ಇಲ್ಲಿ ತೋರಿಸ್ಬೋದು. ಸೊ ಅದು ಇನ್ನೂ ಕೆಲಸ ನಡೀತಾ ಇದೆ, ಲಾಂಚ್ ಮಾಡಿಲ್ಲ, ಬಟ್ ದಿಸ್ ಇಸ್ ದ ಪ್ರಿವ್ಯೂ ಆಫ್ ವಾಟ್ ಯು ಆರ್ ಗೆಟಿಂಗ್. ಇಲ್ಲಿ ನೋಡಿದ್ರೆ ಅನಾಟಮಿ ಹಾಕಿದ್ರೆ ಇಲ್ಲಿ ಸ್ಪ್ರಿಂಗರ್ ನೇಚರ್ ಇಂದ ಬಂದಿದೆ ಒಂದು ಆರ್ಟಿಕಲ್, ಸ್ಪ್ರಿಂಗರ್ ಸೈನ್ಸು, ಇನ್ನೊಂದು ಅದು ಸಿ ಲೈಫ್ ಸೈನ್ಸ್, ಬೇರೆ ಬೇರೆ ಪಬ್ಲಿಷರ್ ಕಡೆಯಿಂದ ಇನ್ಫಾರ್ಮೇಶನ್ ಹೊಡ್ಕೊಂಡು ಬಂದು ಇಲ್ಲಿ ತೋರಿಸುತ್ತೆ. ಇದರ ಮೇಲೆ ಕ್ಲಿಕ್ ಮಾಡಿದ್ರೆ ನಿಮಗೆ ಆಕ್ಸೆಸ್ ಇದ್ರೆ ಓಪನ್ ಆಗುತ್ತೆ, ಆಕ್ಸೆಸ್ ಇಲ್ಲ ಅಂದರೆ ಕ್ಲಿಕ್ ಆಸ್ಕೊಟ್ಟು ಯು ಹ್ಯಾವ್ ಟು ಬಿಕಮ್ ಸಬ್ಸ್ಕ್ರೈಬರ್. ಅದು ಏನಾಯ್ತದು, ಡಿಸ್ಕವರಿ ಆಯ್ತು. ಇನ್ನು ಮುಂದೆ ಪೀರಿಯಾಡಿಕಲ್ಸ್, ಈಗ ಸಾಕಷ್ಟು ಮೆಡಿಕಲ್ ಕಾಲೇಜ್ ಲಕ್ಷಗಟ್ಟಲೆ ಅಥವಾ ಕೋಟಿಗಟ್ಟಲೆ ಯು ಆರ್ ಸ್ಪೆಂಡಿಂಗ್ ಅಂತ ಜರ್ನಲ್ಸ್ ಅಲ್ಲ, ನೀಟಾಗಿ ಯಾವ ಜರ್ನಲ್ ಇದೆ, ಯಾವ ಸಬ್ಸ್ಕ್ರೈಬ್ ಮಾಡಿದ್ರೆ, ಯಾವ ವಾಲ್ಯೂಮ್ ಬಂತು, ಯಾವ ಇಶ್ಯೂ ಬಂತು, ಯಾವ ಬಂದಿಲ್ಲ, ಎಲ್ಲ ಇದರಲ್ಲಿ ಟ್ರ್ಯಾಕ್ ಮಾಡ್ಬೋದು. ವೆಂಡರ್ಗೆಲ್ಲ ರಿಮೈಂಡರ್ ಕಳಿಸ್ತಾರೆ. ಆಮೇಲೆ ಮುಂದಿದ್ದು ಡಿಸ್ಪ್ಲೇ ಬೋರ್ಡ್. ಅಗೇನ್ ಯು ವಾಂಟ್ ಟು ಟೆಲ್ ವಾಟ್ ಯು ಹ್ಯಾವ್ ಇನ್ ದ ಲೈಬ್ರರಿ, ವಾಟ್ ವಿ ರಿಕಮೆಂಡ್. ತಾವು ಏನು ಮಾಡ್ಬೋದು, ಒಂದು ಪವರ್ ಪಾಯಿಂಟ್ ಪ್ರೆಸೆಂಟೇಷನ್ ಮಾಡಿ ಇದರಲ್ಲಿ ಅಪ್ಲೋಡ್ ಮಾಡಿ, 3 ಸ್ಲೈಡು 4 ಸ್ಲೈಡು 10 ಸ್ಲೈಡ್ ಅಪ್ಲೋಡ್ ಮಾಡಿಬಿಟ್ಟು ಯು ಕ್ಯಾನ್ ಗಿವ್ 2 ಸೆಕೆಂಡು 3 ಸೆಕೆಂಡು 5 ಸೆಕೆಂಡ್ ಕೊಟ್ಟರೆ ಬರ್ತಾ ಇರ್ತವೆ. ವೆಲ್ಕಮ್ ಟು ಲೈಬ್ರರಿ, ಹೌ ಟು ಬಾರೋ ದ ಬುಕ್ಸ್, ಹೌ ಟು ಸಿ ದ ಓಪ್ಯಾಕ್, ಇದನ್ನು ನಾವು ಎಷ್ಟು ಬುಕ್ಸ್ ತಗೊಳ್ಬೋದು, ರೂಲ್ಸ್ ಆ್ಯಂಡ್ ರೆಗ್ಯುಲೇಷನ್ ಬರ್ತಾ ಇರ್ತದೆ. ಸೊ ದಟ್ ಇಸ್ ಹೌ ಯು ಕ್ಯಾನ್ ಪ್ರಮೋಟ್ ಯುವರ್ ಲೈಬ್ರರಿ ಸರ್ವಿಸಸ್. Your own publications, NAC, they want definitely, you have to showcase what all publications you have got. Simply what we do is, you can upload all your publication list here, including the URL. NAC dorigu ಒಂದು ID code ಬಿಡಿ ಅವರಿಗೆ. Whenever anybody from NAC wants to check what is in the library, ಅವರು ಲಾಗಿನ್ ಆಗಿರ್ಬೋದು, ಬೇಕಾದ್ರೆ as a student they can check. This is again accessible when I am logging in as a student. ಆಮೇಲೆ ಮುಂದೆ ಸೊ ಯು ಕ್ಯಾನ್ ಫಾರ್ಮ್ ಡಿಫರೆಂಟ್ ಗ್ರೂಪ್ಸ್. ಇಲ್ಲಿ ನೋಡಿ ಸ್ಪೋರ್ಟ್ಸ್ ಗ್ರೂಪ್ ಮಾಡಿದ್ರ, ಕರೆಂಟ್ ಅಫೇರ್ಸ್ ಮಾಡಿದ್ರ, GST ಅಫೇರ್ಸ್ ಮಾಡಿದ್ರ, ಅಥವಾ ಇಲ್ಲಿ ಹಾರ್ಟ್ ಸರ್ಜನ್ಸ್ ಗ್ರೂಪ್, ಪೀಡಿಯಾಟ್ರಿಷಿಯನ್ಸ್, ಬೇರೆ 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 ಎಲ್ಲ ಗ್ರೂಪ್ ಮಾಡಿಬಿಟ್ಟು ಯು ಕ್ಯಾನ್ ಕ್ರಿಯೇಟ್ ಹಿಯರ್. ವೆನ್ ಯು ಲಾಗ್ ಇನ್ as a librarian, you can simply go there, type a message, dear professors, these 5 journals related to pediatrics have come, make the best use of it. That is how you can attract more and more students. Mere ಬೇರೆ ಸ್ಟಾಫ್ ನಿಮ್ಮ ಹತ್ರ ಬರಬೇಕಾದ್ರೆ you communicate it. So this is one of the methods. ಆಮೇಲೆ ಮುಂದೆ again you want to get the feedback from students, library timings ಹೇಗಿದೆ ಅಥವಾ ಕಾಲೇಜ್ satisfaction survey, all of that you can design a survey, publish it. When the student logs in, ಯಾವ ಸರ್ವೆ ಓಪನ್ ಇದೆ ಅಂತ ನೋಡ್ಬೋದು, ಅಲ್ಲಿ ಕ್ಲಿಕ್ ಮಾಡಿ you can give the response. So only when you measure what is the satisfaction, you can come up with the improvement area. ಇಲ್ಲಿ ಕಾಣಿಸ್ತಾ ಇಲ್ಲ ನಮ್ಮ ಬ್ರೋಷರು 6 ಸಿಗ್ಮಾ ಇದೆ. So that is define, measure, analyze, improve, control. So this is to encourage that 6 sigma methodology. Okay. ಆಮೇಲೆ ನೆಕ್ಸ್ಟ್ ಇನ್ಸ್ಟಿಟ್ಯೂಷನಲ್ ರಿಪಾಸಿಟರಿ. ಸೊ ಇದರಲ್ಲಿ ನೀವು ನಿಮ್ಮದೆಲ್ಲ PDF ಇರ್ಬೋದು, ವಿಡಿಯೋಸ್ ಇರ್ಬೋದು, ಲೆಕ್ಚರ್ ನೋಟ್ಸ್ ಇರ್ಬೋದು, ಕ್ವಶನ್ ಪೇಪರ್ಸ್ ಇರ್ಬೋದು, ಜರ್ನಲ್ ಟೇಬಲ್ ಆಫ್ ಕಂಟೆಂಟ್ಸ್ ಇರ್ಬೋದು, ನಿಮ್ಮದೇ ಪಬ್ಲಿಕೇಶನ್ಸ್ ಇರ್ಬೋದು, ಏನು ಬೇಕಾದನ್ನ ನೀವು ಸ್ಕ್ಯಾನ್ ಮಾಡಿ ಇನ್ಸ್ಟಿಟ್ಯೂಷನ್ ರಿಪಾಸಿಟರಿ ಇದರಲ್ಲಿ ಬಿಲ್ಡ್ ಮಾಡ್ಬೋದು. ಆಮೇಲೆ ಇನ್ನೊಂದಿದೆ, ಮುಂಜಾನೆ ಒಬ್ಬರು ಪ್ರೊಫೆಸರ್ ಹೇಳಿದ್ರಲ್ವ, ವೆನ್ ಎವರ್ ಯು ವಾಂಟ್ ಮಟೀರಿಯಲ್, ವೆನ್ ಯು ಆಸ್ಕ್ ಸ್ಟೂಡೆಂಟ್ಸ್ ಆಲ್ಸೋ ಕಮ್ ಅಪ್ ವಿತ್ ಎ ಬಿಗ್ ಲಿಸ್ಟ್ ಅಂಡ್ ಗಿವ್ ಯು. ನಾವು student is giving the material to professor is giving the material to student, fine, but where is the library picture? So now we need to make sure, as a library professional, we need to make sure that library is always in the picture. ಅದಕ್ಕೆ ನೀವೇನು ಮಾಡ್ಬೋದು, ಪ್ರತಿಯೊಂದು ಪ್ರೊಫೆಸರ್ಗೆ ಪರ್ಸನಲ್ ಡಿಜಿಟಲ್ ಲೈಬ್ರರಿ ಅಂತ ಸ್ಪೇಸ್ ಕೊಡ್ಬೋದು, ಎಲ್ಲಿ ಈಸಿಲಿಬಲ್. ನಾನು ಪ್ರೊಫೆಸರ್ ಆದರೆ ಅಲ್ಲಿ ನನಗೆ ಒಂದು ಆಪ್ಷನ್ ಇರುತ್ತೆ, ಅಪ್ಲೋಡ್ ಮೈ ಓನ್ ಕಂಟೆಂಟ್. ನಾನು ನನ್ನ ಮಟೀರಿಯಲು ಬಿಲಾಂಗಿಂಗ್ ಟು ನನ್ನ ಸಬ್ಜೆಕ್ಟು ನನ್ನ ಸ್ಟೂಡೆಂಟ್ಗೆ ಕೊಡಬೇಕಾದ್ರೆ ಇದರಲ್ಲಿ ಅಪ್ಲೋಡ್ ಮಾಡಿಬಿಟ್ಟು ಐ ಕ್ಯಾನ್ ಸೆಂಡ್ ಎ ಮೆಸೇಜ್ ಟು ದ ಸ್ಟೂಡೆಂಟ್ಸ್, ಹಿಯರ್ ಸ್ಟೂಡೆಂಟ್ಸ್ ಹ್ಯಾವ್ ಅಪ್ಲೋಡೆಡ್, ಪ್ಲೀಸ್ ರೆಫರ್ ಹಿಯರ್. ಸೊ ದಟ್ ಇಸ್ ದ ಪರ್ಸನಲ್ ಡಿಜಿಟಲ್ ಲೈಬ್ರರಿ. ಓಕೆ. ಆಮೇಲೆ ಸ್ಟಿಲ್ ಐ ಆಮ್ ಲಾಗ್ಡ್ ಇನ್ as a student. My documents, again the definition of library now is a library information center, right? Anything related to the student, you can ask the student any information that you want from student, you can ask him to go to my documents, upload his information, documents ಎಲ್ಲ ಅಪ್ಲೋಡ್ ಮಾಡ್ಬೋದು. Fees ಅದೆಲ್ಲ, if you take the campus automation, fees ಎಲ್ಲ ಬರುತ್ತೆ. My digital library you are seeing there. So next, service desk I want to show you. What is that service desk? So again, keeping that information in the mind, every organization, ನಿಮ್ಮಲ್ಲಿ ಎಷ್ಟು ಇಕ್ವಿಪ್ಮೆಂಟ್ ಇದೆ, ಇಲ್ಲೇ ಇದರಲ್ಲಿ ನೋಡಿದ್ರೆ ಮೈಕ್ ಸಿಸ್ಟಮ್ ಇದೆ, ಏರ್ ಕಂಡೀಷನ್ ಇದೆ, ವೆಹಿಕಲ್ಸ್ ಇದೆ, ಬಿಲ್ಡಿಂಗ್ ಇದೆ, ಎಲ್ಲಕ್ಕೂ ಮೇಂಟೆನೆನ್ಸ್ ಬೇಕಲ್ವಾ? ಸೊ ವೆನ್ ಎವರ್ ಯಾವುದಕ್ಕಾದ್ರೂ ಮೇಂಟೆನೆನ್ಸ್ ಬೇಕಾದ್ರೆ, ಅಥವಾ ನಿಮ್ಮ ಸ್ಟಾಫ್ಗೆ ಬುಕ್ಸ್ ಬೇಕಾಯಿತು, ಅಥವಾ ದ ಸ್ಟಾಫ್ ವಾಂಟ್ ಸಮಥಿಂಗ್ ಟು ಬಿ ರಿಪೇರ್, ಕಂಪ್ಯೂಟರ್ ರಿಪೇರ್ ಬೇಕಾಗಿತ್ತು, ಅಂತ ಟೈಮಿಗೆ ದೇ ಕ್ಯಾನ್ ಜಸ್ಟ್ ಗೋ ಹಿಯರ್, ಅಲ್ಲಿ ರಿಕ್ವೆಸ್ಟ್ ಸಬ್ಮಿಟ್ ಮಾಡ್ಬೋದು. ನೀಡ್ ಎ ಕಂಪ್ಯೂಟರ್ ರಿಪ್ಲೇಸ್ಮೆಂಟ್ ಅಂಡ್ ದೇ ಪುಟ್ ಆಲ್ ದ ಡೀಟೇಲ್ಸ್. ಸಬ್ಮಿಟ್ ಅಂದರೆ ಕಾಲೇಜಲ್ಲಿ ಯಾರನ್ನ ಫೆಸಿಲಿಟಿ ಮ್ಯಾನೇಜರ್ ಅಂತ ಅಪಾಯಿಂಟ್ ಮಾಡಿರ್ತಾರಲ್ಲ ಅವ್ರಿಗೆ ಒಂದು ಮೆಸೇಜ್ ಹೋಗುತ್ತೆ, ದೇ ಕ್ಯಾನ್ ಟ್ರ್ಯಾಕ್ ಇಟ್. ವೆದರ್ ಇಟ್ ಮೇ ಬಿ ಬಿಯಾಂಡ್ ದ ಸ್ಕೋಪ್ ಆಫ್ ದ ಲೈಬ್ರರಿ, ಬಟ್ ಇಫ್ ಯು ವಾಂಟ್ ಟು ಯೂಸ್ ಇಟ್ ಫಾರ್ ದ ಲೈಬ್ರರಿ, ಡೆಫಿನೆಟ್ಲಿ ಯು ಆರ್ ಮೋಸ್ಟ್ ವೆಲ್ಕಮ್ ಟು ಯೂಸ್ ಇಟ್. ಓಕೆ, ದಿಸ್ ಇಸ್ ದ ಸರ್ವಿಸ್ ಡೆಸ್ಕ್ ಸಿಸ್ಟಮ್. ಓಕೆ, ನೆಕ್ಸ್ಟ್ ದಿಸ್ ಇಸ್ ದ ಪೋರ್ಷನ್ ರಿಲೇಟೆಡ್ ಟು ನಾನು ಯಾವ ಬುಕ್ಸ್ ಬಾರೋ ಮಾಡಿದ್ದೇನೆ, ನಾನು ಯಾವ ಬುಕ್ ಲೈಬ್ರರಿ ಇಲ್ಲ ಅಂದರೆ ಐ ಕ್ಯಾನ್ ಗೋ ಅಂಡ್ ರಿಕ್ವೆಸ್ಟ್ ಬುಕ್, ಪ್ಯಾಟರ್ನ್ ಡಿಫರೆಂಟ್ ಇಕ್ವೇಷನ್, ಫೇವರೇಟ್ ಮೇಂಟೈನ್ ಮಾಡ್ಬೋದು, ಫೈನ್ ಮಾಡ್ಬೋದು, ಯೂನಿವರ್ಸಿಟಿ ಸರ್ಕ್ಯುಲೇಷನ್ ಹಿಸ್ಟ್ರಿ ಎಲ್ಲನೂ ನೋಡ್ಬೋದು. ಓಕೆ, ನೆಕ್ಸ್ಟ್ ಕಮ್ಸ್ ಅ ಲರ್ನಿಂಗ್ ಮ್ಯಾನೇಜ್ಮೆಂಟ್ ಸಿಸ್ಟಮ್. ಸೊ ಇದರಲ್ಲಿ ಸಾಫ್ಟ್ವೇರ್ is recognizing one student by name Vasu is enrolled in 6 courses. 6 courses ಲಿಸ್ಟ್ ಅಂತ ಇದೆಯಲ್ಲ ಅದರಲ್ಲಿ ಎನ್ರೋಲ್ ಮಾಡಿದರೆ, ಅದರ ಮೇಲೆ ಕ್ಲಿಕ್ ಮಾಡಿದ್ರೆ ಆ ಒಂದು ಕೋರ್ಸಲ್ಲಿ ಇಷ್ಟೆಲ್ಲ ಸೆಷನ್ಸ್ ಇದೆ. ಒಂದು ಕೋರ್ಸ್ ಮೇಲೆ ಲಿಸ್ಟ್ ಮಾಡಿದ್ರೆ, ಕ್ಯಾಟ್ಲಾಗ್ ಅಂತ ಕೋರ್ಸ್ ಮೇಲೆ ಅಥವಾ ಸರ್ಕ್ಯುಲೇಷನ್ ಮೇಲೆ ಲಿಸ್ಟ್ ಮಾಡಿದ್ರೆ 5 ವಿಡಿಯೋಗಳು ಕಾಣಿಸ್ತವೆ. ಸೊ ಈ ಸಿಸ್ಟಮ್ನ ನಾವು ಲರ್ನಿಂಗ್ ಮ್ಯಾನೇಜ್ಮೆಂಟ್ ಸಿಸ್ಟಮ್ ನಾವು ಬಿಲ್ಡ್ ಮಾಡಿಬಿಟ್ಟು ನಮ್ಮ ಎಲ್ಲ ಕ್ಲೈಂಟ್ಗಳಿಗೆ ವಿ ಆರ್ ಎನ್ರೋಲಿಂಗ್ ಯು ಆಸ್ ಅ ಸ್ಟೂಡೆಂಟ್. ಸೊ ತಾವು ಈಸಿಲಿಗೆ ಸ್ಟೂಡೆಂಟ್ ಅಂತ ಎನ್ರೋಲ್ ಆದರೆ ನಿಮಗೆಲ್ಲ ಇಲ್ಲಿ ಕ್ವಶನ್ ಪೇಪರ್ಸ್, ಅದು ಸಾರಿ ಇದರಲ್ಲೆಲ್ಲ ವಿಡಿಯೋದು ಆರ್ಗನೈಸ್ಡ್ ಯು ಕ್ಯಾನ್ ಸಿ ದಟ್. ಆಮೇಲೆ ಇನ್ನೂ ಹೊಸ ಮಟೀರಿಯಲ್ ಎಲ್ಲ ಲೋಡ್ ಮಾಡ್ತಾ ಇದ್ದೇವೆ. ನಿಮ್ಮ ಕಾಲೇಜಲ್ಲಿ ನೀಟ್ಲಿ ಯು ಕ್ಯಾನ್ ಆರ್ಗನೈಸ್ ಸಬ್ಜೆಕ್ಟ್ ವೈಸ್, ಗ್ರೇಡ್ ವೈಸ್, ಆಲ್ ದಿಸ್ ಮಟೀರಿಯಲ್ ದಟ್ ದ ಸ್ಟೂಡೆಂಟ್ಸ್ ಕ್ಯಾನ್ ಆಕ್ಸೆಸ್. ಓಕೆ, ಆಮೇಲೆ ನಾರ್ಮಲ್ ಫೀಡ್ಬ್ಯಾಕ್, ದೊಡ್ಡ ಏನು ಬೇಡ, ಚಿಕ್ಕದು ಒಂದು ಫೀಡ್ಬ್ಯಾಕ್, ಒಂದು ಸಿಂಪಲ್ ಫೀಡ್ಬ್ಯಾಕ್, ಓಕೆ ಲೈಬ್ರರಿ ನನಗೆ ಎಕ್ಸ್ಟೆಂಡ್ ಆಗಬೇಕು ಅಥವಾ ನನಗೆ ಈ ಹೆಲ್ಪ್ ಬೇಕು, ಸಿಂಪಲ್ ಫೀಡ್ಬ್ಯಾಕ್ ಇದೆ. CRM ಕಮ್ಯುನಿಕೇಶನ್, ಸೊ that is again related to student information. ಸೊ ಲಾಸ್ಟ್ ಆಮೇಲೆ ನಿಮ್ಮ ಸ್ಟೂಡೆಂಟ್ಗಳಿಗೆ ಅಥವಾ ನಿಮ್ಮ ಪ್ರೊಫೆಸರ್ಗಳಿಗೆ ಗ್ರೂಪ್ ಮಾಡೋಕ್ಕೆ ಅವಕಾಶ ಕೊಡ್ಬೋದು, ಸಬ್ಸ್ಕ್ರಿಪ್ಷನ್ ತೊಗೊಳ್ಬೋದು, ಅದನ್ನ ಕೆಲಸ ನಡೀತಾರೆ. ಸೊ ದಿಸ್ ಈಸ್ ಆಲ್ ಐ ಆಮ್ ಲಾಗ್ಡ್ ಇನ್ ಆಸ್ ಅ ಸ್ಟೂಡೆಂಟ್ ಅಂಡ್ ಚೆಕಿಂಗ್. ನಾವು ವೆನ್ ಯು ಲಾಗಿನ್ ಆಸ್ ಅ ಲೈಬ್ರರಿಯನ್ ಆದಾಗ ಇಲ್ಲಿ ನಿಮಗೆ ಅಲ್ಲಿ ಆಪ್ಷನ್ಸ್ ಕಾಣ್ತೇವೆ, ಹೋಮ್, ಮೆನು, ವಾಸು, ಸಪೋರ್ಟ್, ಲಾಗ್. ಹೋಮ್ ಅಂದರೆ ಇಟ್ ವಿಲ್ ಕಮ್ ಬ್ಯಾಕ್ ಟು ದಿಸ್ ಮೇನ್ ಪೇಜು. ಮೆನು ಅಂದರೆ ಈ ಪೇಜ್ ಕಾಣಿಸ್ತಾ ಇಲ್ಲ. ಓಕೆ, ನನ್ನ ಹೆಸರು ಮೇಲೆ ಕ್ಲಿಕ್ ಮಾಡಿದ್ರೆ now okay, this is a different Vasu who is the administrator for this library. Illi he will see the dashboard that is appropriate for his role. He could be principal, he could be professor, he could be circulation librarian, he could be catalog librarian. Based on that their role, you can define a dashboard. Our click adana click madre avarige iruvanta adu dashboard sigutte. Next support button ideyalla, whenever nimge software use ಮಾಡಬೇಕಾದ್ರೆ ಹೆಲ್ಪ್ ಬೇಕಾದ್ರೆ ವೆರಿ ಸಿಂಪಲ್, ನಿಮ್ಮ ಎಲ್ಲ ಸ್ಟಾಫ್ಗೆ ಹೇಳ್ಬಿಡ್ಬೋದು, ಜಸ್ಟ್ ಸಪೋರ್ಟ್ ಮೇಲೆ ಕ್ಲಿಕ್ ಮಾಡಿ ಈ ಥರ ಒಂದು ಆಪ್ಷನ್ ಬರುತ್ತೆ. ಇಲ್ಲಿತ್ತಲ್ಲ ಅದು ಯಾವುದು, ಈ ಥರ ಒಂದು ಸ್ಕ್ರೀನ್ ಬರುತ್ತೆ. ಯು ಕ್ಯಾನ್ ಪುಟ್ ಎ ರಿಕ್ವೆಸ್ಟ್ ಹಿಯರ್, ಐ ನೀಡ್ ಹೆಲ್ಪ್ ಇನ್ ಯೂಸಿಂಗ್ ದ ಡಿಜಿಟಲ್ ಲೈಬ್ರರಿ, ಐ ವಾಂಟ್ ಟು ನೋ ಹೌ ಟು ಬಿಲ್ಡ್ ಪರ್ಸನಲ್ ಡಿಜಿಟಲ್ ಲೈಬ್ರರಿ. ಆ ಟಿಕೆಟ್ ಹಾಕಿಬಿಟ್ರೆ ಸಾಕು, ನಮ್ಮ ಈಗಲೇ ಟೀಮ್ಗೆ ಒಂದು ಮೆಸೇಜ್ ಬರುತ್ತೆ. ಬಂದ ತಕ್ಷಣ then our team will look at it and then it goes into the queue. So we try to resolve it within 3 to 5 days. Okay, sometimes it may take long. Okay, ಆಮೇಲೆ ಇನ್ನೂ ಕೆಳಗಡೆ ಹೋದ್ರೆ ನೋಡಿದ್ರೆ ಇಷ್ಟೆಲ್ಲ ಫೆಸಿಲಿಟಿ ಇದೆ. ಇಲ್ಲಿ API ಮ್ಯಾನೇಜ್ಮೆಂಟ್ ಅಂದರೆ RFID you can buy from any vendor, ಇದರಲ್ಲಿ has the capability integrate. APIs ಎಲ್ಲ ಇರೋದು. ಅಸೆಟ್ ಇನ್ವೆಂಟರಿ ಮ್ಯಾನೇಜ್ಮೆಂಟ್ ಟೇಬಲ್ ಕುರಿತು ಮಾತಾಡೋದಿಲ್ಲ, ಅದನ್ನು ಕ್ಯಾಟಲಾಗ್ ಮಾಡೋಕ್ಕೆ. ಬಾರ್ಕೋಡ್ ಯು ಕ್ಯಾನ್ ಪ್ರಿಂಟ್ ಬಾರ್ಕೋಡ್, ಈ ಥರ ID ಕಾರ್ಡ್ಸ್ ಎಲ್ಲ ಈಗಲೇ ಪ್ರಿಂಟ್ ಮಾಡಿಬಿಡ್ಬೋದು. Batch processing which will run in the nightly, fine calculation, sending the reminders and all that. Communication with the student group formation, conduct student survey ನೋಡಿ ಆಯಿತು. ವರ್ಚುವಲ್ ಕಲೆಕ್ಷನ್ ಅಥವಾ ಕೋರ್ಸ್ ರಿಸರ್ವ್ ಅಂತಾರಲ್ಲ, ಅದನ್ನು ಈಚ್ ಪ್ರೊಫೆಸರ್ ಕ್ಯಾನ್ ಬಿಲ್ಡ್ ಎ ಕೋರ್ಸ್ ರಿಸರ್ವ್. ಈಗ ಫಸ್ಟ್ ಇಯರ್ MBBS ಅನಾಟಮಿ, ಸೆಕೆಂಡ್ ಇಯರ್ ಲೆಟ್ಸ್ ಎ ಸರ್ಜರಿ, ಏನೇನು ನೋಡ್ಬೇಕಾದ್ರಲ್ಲ ದೇ ಕ್ಯಾನ್ ಬಿಲ್ಡ್ ಒನ್ ಕೋರ್ಸ್ ರಿಸರ್ವ್. ಡ್ಯಾಶ್ಬೋರ್ಡ್ ಮೆಟ್ರಿಕ್ಸ್ ಅಂದರೆ ಈ ಬೇರೆ ಬೇರೆ ಡಿಸ್ಪ್ಲೇ ಆಗುತ್ತೆ. ಕ್ವಾಲಿಟಿ ಬೋರ್ಡ್, ಡೇಟಾ ಕ್ವಾಲಿಟಿ ಇಂಪ್ರೂವ್ಮೆಂಟ್. ಸಾಫ್ಟ್ವೇರ್ has the intelligence to try out what is wrong in the data. For example, ನೀವು ಈಗ ಟಾಟಾ ಮ್ಯಾಕ್ ಗ್ರಾಹಿಲ್ ಒಂದು ಎಂಟ್ರಿ ಮಾಡಿರ್ತಾರೆ, ಕೆಲವೊಂದು ಕಡೆ TMH ಮಾಡಿರ್ತಾರೆ, ಕೆಲವೊಂದು ಕಡೆ ಟಾಟಾ ಸ್ಪೇಸ್ ಮ್ಯಾಕ್ ಅಂತ ಮಾಡಿರ್ತೀರ. ಸೊ ಸಾಫ್ಟ್ವೇರ್ ಹ್ಯಾಸ್ ದ ಎಬಿಲಿಟಿ ಟು ಶೋ ಆಲ್ ದಿಸ್, ಯು ಹ್ಯಾವ್ ದ ಎಬಿಲಿಟಿ ಟು ಮರ್ಜ್ ಆಲ್ ದೋಸ್ ಪಬ್ಲಿಷರ್ಸ್ ಇಂಟು ಒನ್ ಪಬ್ಲಿಷರ್. ಆಮೇಲೆ ಡೋನರ್ ಅಂಡ್ ಅಲಮ್ನಿ ಮ್ಯಾನೇಜ್ಮೆಂಟ್, ದಟ್ ಇಸ್ ದ ನೆಕ್ಸ್ಟ್ ಸ್ಟೆಪ್. ಇನ್ನು ಅಲಮ್ನಿ ಇಸ್ ಆಲ್ಸೋ ಯು ಕ್ಯಾನ್ ಮ್ಯಾನೇಜ್ ಇನ್ ದ ನೆಕ್ಸ್ಟ್ ಇದರಲ್ಲಿ 7.2 ವರ್ಷನ್. ಅಸೈನ್ಮೆಂಟು, ಅಟೆಂಡೆನ್ಸು, ಗ್ರೇಡ್ ಕ್ಲಾಸು, ಲರ್ನಿಂಗ್. ಇನ್ನೂ ಕೆಳಗಡೆ ಹೋದರೆ I can't show it here, but ಇದರಲ್ಲಿ the normal functions of the library that you have seen, acquisition, so requisition, acquisition, cataloging, circulation, membership, OPAC, all of those are available. One thing on the acquisition part, the new software, new version also has the ability, ನೀವು ನಿಮ್ಮ ವೆಂಡರ್ಗೆ ಆಕ್ಸೆಸ್ ಕೊಡ್ಬೋದು. ಅವರು ಈಸಿಲಿ ಲಾಗಿನ್ ಆಗಿಬಿಟ್ಟು ನಿಮ್ಮ ರಿಕ್ವೆಸ್ಟ್ ಫಾರ್ ಪ್ರಪೋಸಲ್ಗೆ ಪ್ರೈಸ್ ಹಾಕ್ಬೋದು. ಯು ಕ್ಯಾನ್ ಈವನ್ ಕಂಪೇರ್ ದ ಪ್ರೈಸಸ್ ಆಲ್ಸೋ. ಸೊ ಸುಮಾರು ಫೀಚರ್ಸ್ ಇದೆ. ಐ ಕ್ಯಾನ್ ಗೋ ಕಂಟಿನ್ಯೂಸ್ಲಿ ಫಾರ್ 2-3 hours ಆಲ್ಸೋ. ಸದ್ಯಕ್ಕೆ ಇಲ್ಲಿಗೆ ಸ್ಟಾಪ್ ಮಾಡ್ತೇನೆ. ನಮ್ಮದು ಹೊರಗಡೆ ಅಲ್ಲಿ ನಮ್ಮ ಸಿದ್ಧಲಿಂಗೇಶ್ವರ ಇದ್ದಾರೆ, ನಾವು ಇಬ್ಬರು ಬಂದಿದ್ದೇವೆ. ವಿ ಆರ್ ಹಿಯರ್ ಟುಡೇ ಆ್ಯಂಡ್ ಟುಮಾರೋ ಆಲ್ಸೋ. ಪ್ಲೀಸ್ ಸ್ಟಾಪ್ ಎನಿ ಟೈಮ್. ಆಮೇಲೆ ನಿಮಗೆ ಡೆಮೋ ನೋಡೋದಿದ್ರೆ ಇಲ್ಲಿ easylim.net ನಮ್ಮ ವೆಬ್ಸೈಟು, ಅಲ್ಲಿ ಕನ್ನಡದಲ್ಲಿ ಡೆಮೋ ಇದೆ, ಹಿಂದಿಯಲ್ಲಿದೆ, ಇಂಗ್ಲೀಷಲ್ಲಿದೆ, ಸುಮಾರು ಡೆಮೋ ಇದೆ. ಆ್ಯಂಡ್ ಇಫ್ ಯು ಹ್ಯಾವ್ ಫರ್ದರ್ ಕ್ವಶನ್ ಎನಿ ಟೈಮ್ ಯು ವಾಂಟ್ ಟು ರೀಚ್ ಅಸ್, you can reach. This is a little background where all team work actually. GE, Infosys, Siemens, IBM, Apple. These are the places where our team members work, bringing all the whatever they are learning to easily. Okay, product, service, innovation are our focus. And our client, thank you very much. We are seeing a lot of clients here, so I am really grateful because you are the ones who gave a lot of ideas actually. Seriously, all the ideas definitely are coming. You ಪ್ರಕಾಶ್ ಅವರು ಹೇಳಿರ್ತಾರೆ, ಶಶಿಕಲಾ ಮೇಡಮ್, ದಾಮೋದರ್ ಅವರು ಹೇಳಿರ್ತಾರೆ, ಮತ್ತೆ ರವಿ ಶಿವನಾಥ್ ಹೇಳ್ತಾರೆ, ಎಲ್ಲ ಕಡೆಯಿಂದ ನಮ್ಗೆ ಅದು ಬೇಕು ಇದು ಬೇಕಂದ್ರೆ ದಟ್ ಇಸ್ ಹೌ ವಿ ಆರ್ ಎನ್ಹಾನ್ಸಿಂಗ್ ದ ಸಾಫ್ಟ್ವೇರ್. Really thank you for all the customers. By the way, RIMS is our customer. I wanted to show one. Based on the feedback with multiple people, we worked out a 50-item checklist. Okay, so all of these are being sent to all the librarians now, all our customers. So this tells, have you connected your OPAC to college website? Second, have you conducted orientation to first year student? Have you conducted orientation to third year, second year student? Facebook create ಮಾಡಿದ್ದೀರಾ, Twitter create ಮಾಡಿದ್ದೀರಾ, YouTube ಚಾನಲ್ ಇದೆಯಾ ಲೈಬ್ರರಿಗೆ, Vimeo ಚಾನಲ್ ಇದೆಯಾ, ಇಮೇಲ್ ಗ್ರೂಪ್ ಮಾಡಿದ್ದೀರಾ, ಒಂದು 50 ಐಟಮ್ಸ್ ಇದೆ. ಸೊ ಥ್ಯಾಂಕ್ ಯು ಫಾರ್ ಆಲ್ ದ ಪೀಪಲ್ ಹೂ ಆರ್ ಗಿವನ್ ದ ಫೀಡ್ಬ್ಯಾಕ್ ಆನ್ ದಿಸ್. ಆ್ಯಂಡ್ my promise to RIMS is that we will work with them to implement a lot of these new things here also. It's just still going on, the implementation is going on. Thank you very much for the opportunity here. Glad to be part of this group and good to see so many people here. Thank you. Okay, if there are no questions, thank you so much.
Sir, I now request a representative from British Medical Journal to come on the dais and give his product presentation.
So I just want to, I will not take much of your time. So I will just share you what all the resources we can offer for your institution. And so to begin with, BMJ is a non-commercial publishing company started in the year 1840. So we are in the market for almost 180 years as of now. So what we do is, our vision is to achieve a healthier world, and how we provide a healthier world is by providing the most updated information by better evidence, better patients and better systems. So coming up to our products actually, so these are all our portfolios. So we have medical education, then we do have clinical decision support tool, then we do conduct events like BMJ Awards, BMJ Master Classes, then we also provide support on publishing. And so in terms of publishing support, we provide BMJ journals, case reports and research publication. So these are all our resources which can be highly useful for your library. So coming up the first resource, the BMJ best practice. It's an instant clinical decision support tool straight to the point of care. So it contains more than 15,000 conditions, the treatment guidelines for 15,000 diseases and conditions. So it provides instant diagnosis methods to all the doctors and users, and it is also available offline on a mobile app. So this is the only tool which supports our doctors to treat patients who are facing multiple conditions like comorbidities. For example, if a patient is admitted to the hospital with a kidney injury, and if he is having an underlying hypertension or diabetes, the treatment conditions will change. So this is the only tool which provides a support tool for variation in the underlying conditions. So it is highly useful for the doctors, undergraduate students and postgraduate students who are visiting the hospitals. So these are all the uniqueness of our tool. It has a lot of procedural videos, then evidences, then local guidance tools, and we can also support with various languages like patient leaflets, which is available in more than 92 languages. So coming up next is the next resource, which is our journals. So our flagship journal, the BMJ, which is published in the year 1840, the current impact factor of that particular journal is around 29. So from 1840 to till date, we are publishing on a weekly basis. And BMJ is publishing more than 70 journals, and we provide perpetual access for all our journals. So if an institution is subscribing, for example in 2022, the 2022 content is available with you lifelong, even if you are not continuing the subscription next year. So whatever content you are subscribed, you will be having the access. And during the period of subscription, we will be providing you the access to back volume also, from volume 1 issue 1. So BMJ is the only publisher which provides back volume issues from volume 1 issue 1. Other publishers provide only for 10 years or 15 years. And we have high impact journals like Journal of Epidemiology and Community Health, Heart, Gut, Journal of Clinical Pathology. All the journals which are all top ranked in their respective specialties. The next resource I would like to share is on BMJ Learning, which is an online CME platform. So the last session was also mostly on e-learning. So this is an e-learning tool which is peer reviewed. We are having more than 1,800 e-learning modules actually. This helps our doctors and students to gain more clinical knowledge and practical skills. And this is accredited by various reputed medical councils, and Karnataka Medical Council has also accredited BMJ Learning. So during the COVID pandemic time, many of the doctors used this as an online CME. They were able to gain the accreditation points required by the Karnataka Medical Council. This is our resource called research to publication. So far we were seeing about the clinical decision support tool and other resources. This is on something which helps our doctors to get their articles published with original journals of BMJ. For example, BMJ is publishing more than 70 journals. So in 70 journals, there are around 30 to 40 open access journals. Normally open access journals, author has to pay an article processing fee. So here in research to publication, this is an online platform which helps our doctors to develop their research skills. So once they complete these modules, they will be well prepared to submit their article with any of the reputed journals, and it will get published easily. And from BMJ, how we support is, there are 52 modules. In 52 modules, if they are completing any 5 modules, then the article processing fees in all the open access journals gets waived off for the author who is completing the modules. So in this way, the authors can save a lot of money, and it is also a privilege for the institution, because all the journals from BMJ are indexed in Scopus and PubMed. So it is a very good privilege for the institution also. So it is a very good opportunity. Just our doctors has to complete any 5 modules from this platform, and then they can avail the unlimited publishing opportunity with any of the BMJ group journals, that too open access. And the final resource which I would like to share you is on BMJ case reports. So this is also a part of e-learning also, because this provides an online bedside learning opportunity for our doctors. Because this is the largest repository of medical case reports. It is having more than 30,000 case reports. And during the pandemic times, the students and doctors who were learning could not visit the hospital due to the lockdown issues. So they were able to access BMJ case reports, and they were able to learn directly from the patients. So we provided the online bedside learning opportunity. And here also in BMJ case reports, the institution is having an advantage that if a college is subscribing to BMJ case reports, then any number of doctors and users from that college can publish any number of case reports without paying any article processing fee. So that is a fellowship model we are providing in BMJ case reports. And this is also indexed in Scopus and PubMed. So in a way it also helps our doctors. So here there are librarians from dental colleges also. So case reports submission will also add their value in terms of their promotional and other career aspects. So these are all the resources which we are publishing from BMJ. So I request everyone to support BMJ, and for any inquiries you can kindly contact me. So the conference kit is having our brochures with all the resources, and it is also having our contact details. So you can very well contact me in case of any clarifications and for any subscription inquiries. Thank you very much, sir. So this is my contact details. Any questions? Actually, in Karnataka,
I wanted to add that BMJ has given API access. So we work with BMJ to give access to the BMJ article directly from EasyLib also.
So we are publishing with the BMJ also from our
API actually, which is a very good thing. So that wherever anybody wants to search on EasyLib, right, you can put let's say whatever subject. If they cannot have it, there is a link called BMJ. It will go to BMJ, and then from there it goes to the BMJ site. But that link is available next to BMJ for the APIs.
Thank you. So last year actually.
I request Dr. Shashikala ma'am to grace the dais and present a memento to the paper presenters. First, I would like to call Mr. Naveen KS to grace the dais and collect his memento.
Hi.
Thank you, sir. I now
Thank you, sir. I now request Thank you, everyone. Now let us proceed with the next session, that is technical.
I request Mrs. Kavita S., Assistant Librarian, SDM College of Physiotherapy, Dharwad, to come on the dais as a reporter. UB sir, who presents a paper on the role of digital library in developing virtual learning environment in health sciences. I request Mr. Damodara sir to grace the dais.
Good evening, one and all. Damodar sir, please.
Everybody, my name is Damodar Jobi. I am from Mangalore, A.B. Shetty Institute of Dental Science, Derlakatte, Mangalore, Junior Library. Title of my paper is The Role of Digital Library in Developing Virtual Learning Environment in Health Science Institutions. Coming to the introduction part, we know that learning is one of the very important foundations of society. The recent spread of COVID-19 pandemic has brought an unexpected impact on the learning process. In this changing scenario, virtual learning courses, both in primary and higher education, implicit the importance and benefits of information and communication technologies in education system. Today, virtual learning concept becomes very much popular in all kind of education and especially in health science education system. What is virtual learning environment? Virtual learning environment or really is a design space for teaching and learning. Virtual learning environment enhances the learning process virtually. Virtual learning environment is a web-based platform for the online aspects of courses or studies in an education, technology or institutions. Now almost yearly have been adopted in all the universities and higher education system. Virtual learning includes all forms of electronically supported learning process. Terms like CBT, computer-based training, CBT, CI, computer-based instruction, web-based training, and technology-enhanced learning. All these have been used similar to virtual learning environment or VLE. There are 2-3 types of virtual learning. I don't want to go for this because already we have been discussed in this last papers. I'll directly go to role of digital library developing virtual learning. Digital library have brought a very much great changes in providing the right information to the right user at the right time. Digital library allows the library patrons to avail online materials without any restrictions. All the electronic versions of full text documents and images can access from the library when it is required. Digital libraries are accessed via the World Wide Web from anywhere and anytime. The digital contents of the digital library enhances the user to advanced searching and advanced features of relevant documents. It provides simultaneous access possibilities of same electronic content in different places. It provides different formats such as animation, graphics, audio and video to access in a faster mode. Digital libraries can share the information with other digital library by using the proper metadata and information exchange protocols. The digital library also facilitates the preservation of document for longer period in a very short time. Digital library play a very important role and a significant role in applying virtual learning process. These advantages of digital library allows the e-learners to use electronic resources from anywhere, anytime, without its geographical base. So these are the advantages of using web API, CD, DVDs access, institution repositories. Means here now, as we know, health science, almost all the health science institutions have institution repositories. The main purpose of adopting institution repositories to preservation, archiving, dissemination, and sharing of information for its user. So it will all these will helps to support the virtual learning process. I have made a study for virtual learning during COVID-19 pandemic. The study was conducted after third wave of COVID-19 by distributing a questionnaire to the RIMS-RAICHUR Memorial Institute of Dental students. The questionnaire distributed to a total 120 students. Out of 650 students, I could distribute to only 120 students. Now, out of 120 students, I have received only 81 students response. The questionnaire divided into 4 parts. The part 1 is basic question like demographical details. The second part, it's on 6 sets of options regarding advantages and disadvantages of virtual learning and also face-to-face learning. Comparison has been made the face-to-face studying with the online learning process, and part 4 is a level of comfort and acceptance of online classes with the 5 points Likert scale. The results have shown from the students is advantages of virtual learning. About 68% of the students, they opinion the virtual learning is advantage. One of the advantage is access to online material, and 64% of the students have opinion that it can learn on your own way, and 69% says that it is one of the advantages that ability to stay home. 23% they say advantage it is ability to record a meeting, and only 3% of the students have opinion that class interactivity is only 3% of the students have responded it is advantages, and now it is 51% of the students opinion that it is one of the very big advantage of comfortable environment. In the context of comfortable environment, 51% of the students opinion that it is an advantage. As far as coming to the disadvantage of virtual learning, 47% of the students, their opinion that interaction with the teacher, it is one of the disadvantage, and 59% says it is a technical problems, 54% says lack of interaction with the patients, 18% of the students said poor learning environment at home, and 49% of the students have opinion that lack of self-discipline, and about 44% of the students opinion that social isolation was a disadvantage of virtual learning or e-learning. When comparison of face-to-face learning and virtual learning, I have given the 5 points in the as definitely ineffective, less effective, somewhat effective, very effective, and definitely effective. On the context of increase of knowledge, students' opinion on face-to-face learning, 6% of the students says that it is definitely ineffective, whereas 12% of the students says that it is definitely effective on the context of increase of knowledge. Whereas in online, only 7% of the students have opinion that definitely it is ineffective, and 16% of the students their opinion that it is definitely effective. When coming to the clinical skills, only 1% of the students have opinion that it is definitely ineffective, whereas 50% of the students they have opinion that as far as concerned with the clinical skills, it is definitely effective. Now it is a very important thing is, as far as the clinical skills, the students are, because it comes under as it is a practical things. Because of that, the students' opinion is, 50% of the students' opinion is, face-to-face learning is a very good, it is an advantage more, means it is a more effective. As far as concerned with the online learning, on the context of clinical skills, 37% of the students' opinion that it is online learning, it is definitely ineffective, and whereas only 2% of the students' opinion that it is definitely ineffective. When it comes to the online learning, students' opinion is 37% is definitely ineffective, and definitely effective is only 2% students' opinions. So when it comes to the social skills, again it's the same as clinical skills. Only 1% of the students' opinion it's definitely ineffective, and whereas 45% of the students' opinion is definitely effective. And on online learning context, there are 39% of the students have opinion that it is definitely ineffective, and only 2% of the students is opinion that definitely it is effective. Means online learning, only 2% of the students are agree that 2% the social skills only 2%. And a student's response on activity during online learning is also on 5-point legal scales. I have given the questions. One is extremely inactive, less inactive, active, very active, and extremely active. 18% of the students on online learning says that it is extremely inactive, whereas only 10% of the students says that it is extremely active as far as concerned with the online. When the students response on activity during face-to-face learning, students' opinion that only 1% of the students says that it is extremely inactive, and whereas 41% of the students' opinion that it is very active, and extremely active is more than 25% students have opinion that 25% students have opinion that it is extremely active. See, this is the face-to-face learning, because face-to-face learning is when you come into the practical thing, students will like more in face-to-face learning. When the question comes to the level of acceptance of e-learning, students' opinion, about 10% of the students are opinion that extremely it is enjoyable, and very much enjoyable 70%, just enjoyable 28.25%, and very much enjoyable 30% and extremely enjoyable 15.5%. These are the results I have got it from the students on that questions. Coming to the conclusion part, the above discussed study shows that it uses positive perception regarding virtual learning. Even though the area of study is limited to a specific institution, the result reflects the inner perception of larger user community. Another very important point we could make out that the concept of virtual learning existed even before the recent pandemic, but it is reached the whole user community just after the COVID-19 pandemic. Thus it is for all of us, especially for the librarians, health science librarians, it is inevitable health science library also to cope up with the changing developments of the educational system to survive. Thank you so much.
Functionalities like creating notes, highlights, book sections, create the playlist. Add your own content, PDF files, URLs to be added to the platforms, and to create and study the materials suggested by the readers and students. Moving forward, coverages. These are the subject areas being covered for the undergraduates. All the subject areas in the 4 years of curriculum, it's been covered. Multimedia images. As I already informed, it is more than 50,000 images what we have in our content and more than 1,000 videos which is have for the undergraduate courses, which help the undergraduate students to have a practical knowledge to overviewing these images. Playlist. The major functionality of this database. The user can create and manage playlists for different topics and subject areas. Save your reading materials at one place. Import external articles, book chapters as well. Add your logos to give your playlist more personalized look. The user can share the playlist with your colleagues, classmates in the complete institutions as well. Moving forward, with the registered user within the Metron platform to get access from home. This gives and highlight sections of the book, taking notes, save searches, creates and saves the platform. Access and save your progress in training in question and answers. And user of our mobile access, which can be downloaded with Android and iOS app. Anywhere access, use your My Mobile Med1 credential for login, read on the go. Offline downloads, complete ebooks can be downloaded offline. Watch videos and images. Create and update your playlist. These are our well-known international journals with a high impact factor. Like most of the institutions who are already been subscribing our products on endoscopy, thrombosis and hemostasis, liver diseases and plastic surgeries with the high impact factors. Moving forward with the print journals. We have started journal program in India in 2015 with just 4 journals. And as on 2021, the India themed journals with the society's help, we are publishing more than 30 journals as of now. Most of the Indian journals published by theme are multi-indexed, are indexed in services like Scopus, Web of Science, DOAG and many others. We have acquired, a recent acquisition has been done, some big journals during the course of like Indian Journal of Radiology and Imaging, Indian Journal of Plastic Surgery, Indian Journal of Laboratory Physicians and much more well-indexed journals which is being acquired by THEMA in recent past. Over 15 journals published by THEMA are now more than 10 years old published. And these are the highlighted 23 journals which are giving to consortia as there is a possibility to give as a consortia the consider as an Indian impact to give reports. These are the 23 journals. Thank you all. If there are any questions, I will be happy to answer.
Request a representative from ProQuest to present their product.